Hello everyone, I'm Dr. Sandeep Nagre, and today's episode is all about understanding the different medical specialties, what they do, and when it's time to visit them. Have you ever wondered, should I see a cardiologist for chest pain? Or is this something my primary care doctor can take care of it? Or when is it time to consult a specialist for a skin issue or joint pain? Well, today we're breaking it down to help you navigate the healthcare system with confidence. Let's start with your primary care provider, or PCP, your healthcare starting point. They're your first stop for most medical issues. Think of them as the quarterback of your healthcare team. Routine checkups, preventive care, management of chronic conditions like high blood pressure or diabetes. These are the things a PCP handles daily. They can also refer you to specialists if needed. Now, let's talk about cardiologists, the heart experts. These are specialists who focus on diagnosing and treating heart and blood vessel conditions. If you experience chest pain, shortness of breath, palpitations, or if you have risk factors like high cholesterol, hypertension, or a family history of heart disease, your PCP might refer you to a cardiologist. Cardiologists perform tests like EKGs, echocardiograms, or stress tests to assess heart health. They can prescribe medications or recommend lifestyle changes, and in some cases, perform procedures like angioplasty to treat heart disease. Next, pulmonologists, the lung and respiratory specialists. They who focus on diseases affecting the lungs and respiratory system. If you're dealing with chronic cough, shortness of breath, asthma, or more serious conditions like COPD or lung infections, a pulmonologist is the specialist you'll want to see. When should you visit them? If you have breathing difficulties that don't improve with standard treatment, or if you have a chronic lung disease, a pulmonologist can perform tests like lung function tests or bronchoscopy to help determine the cause of your symptoms and recommend the best treatment plan. Dermatologists are the go-to specialists for anything chronic related to your skin, hair, or nails, whether it's acne, eczema, psoriasis, or something more serious like skin cancer. Dermatologists are trained to diagnose and treat a wide range of skin conditions. When should you visit them? If you notice a mole changing shape, size, or color, have persistent rashes, or experience hair loss, these are all good reasons to make an appointment with a dermatologist. Regular skin checks are also a great way to catch any early signs of skin cancer. Next up, we have orthopedic surgeons who specialize in diagnosing and treating issues related to the bones, joints, muscles, ligaments, and tendons. Common reasons to see an orthopedic surgeon include chronic joint pain, sports injuries, or even fractures. When to visit? If you have ongoing joint pain that doesn't improve with rest, a persistent sports injury, or if you think you've broken a bone, it's time to seek out an orthopedic specialist. They can offer non-surgical treatments like physical therapy, or if necessary, perform surgeries like joint replacements or ACL repairs. Neurologists, the brain and nerve experts. They focus on the brain, spinal cord, and nervous system. If you experience symptoms like severe headaches, dizziness, numbness, or weakness, or if you have conditions like epilepsy, multiple sclerosis, or Parkinson's disease, a neurologist is the specialist to see. When should you visit them? Anytime you have unexplained neurological symptoms, such as tingling, muscle weakness, or chronic migraines, that aren't improving, it's a good idea to see a neurologist. They can perform tests like MRIs or nerve studies to figure out what's going on and provide specialized care. Next, let's talk about gastroenterologists or GI specialists. Focus on the digestive system, the stomach, intestines, liver, and pancreas. Common conditions they treat include acid reflux, irritable bowel syndrome, and inflammatory bowel diseases like Crohn's disease or ulcerative colitis. When should you see a GI specialist? If you have persistent digestive issues, unexplained weight loss, or blood in your stool, these are signs it's time to see a gastroenterologist. They can perform diagnostic tests like endoscopies to get to the root of your symptoms. Next, endocrinologists specialize in hormone-related conditions such as diabetes, thyroid disorders, and adrenal or pituitary gland issues. These conditions can affect various aspects of your health, from energy levels to metabolism and even mood. When to visit them? If you have trouble controlling your blood sugar, unexplained weight changes, or symptoms of a thyroid imbalance like fatigue or heart palpitations, an endocrinologist can help manage these conditions with targeted treatments and lifestyle recommendations. Next, nephrologists, kidney specialists. If you have conditions like chronic kidney disease, kidney stones, or abnormalities in your electrolyte levels, a nephrologist is the specialist you'll need to see. When should you visit them? If you experience swelling in your legs or face, changes in urination patterns, or are diagnosed with conditions like high blood pressure or diabetes that can affect your kidney function, it's a good time to see a nephrologist. They help manage chronic conditions and slow the progression of kidney diseases. Now, let's discuss about urologists. They are kidney, urinary tract, and male reproductive specialists. Urologists focus more on the surgical issues with the urinary system in both men and women and the male reproductive system. They treat conditions like urinary tract infections, kidney stones, cancers related to this system, bladder problems, and issues related to male fertility or prostate health. When should you visit them? If you experience blood in your urine, painful urination, difficulty urinating, or have concerns about prostate health, it's time to see a urologist. Men over 50 are also encouraged to see a urologist regularly to monitor prostate health. Hematologists, oncologists are dual specialists who focus on diseases of the blood and cancers. Hematologists treat conditions like anemia, bleeding, and clotting disorders. Oncologists, on the other hand, diagnose and treat various types of cancer, including solid tumors like breast, lung, or prostate cancer. When should you visit them? If you're diagnosed with any form of blood disorder, such as abnormal bleeding, clotting issues, or cancers, your care will involve a hematologist-oncologist. They can provide advanced treatments like chemotherapy, immunotherapy, or blood transfusions. Next up, podiatrists, foot and ankle specialists. Podiatrists focus on treating conditions related to the feet, ankles, and lower legs. Whether it's common issues like bunions, plantar fasciitis, or more complex problems like diabetic foot care, podiatrists help keep you on your feet. When should you see a podiatrist? If you're experiencing foot pain, persistent swelling, or any injury to your feet or ankles, a podiatrist can diagnose the problem and provide specialized care, from orthotics to surgery if necessary. Obstetricians and gynecologists, ObGyn, women's health experts. They specialize in women's health, including reproductive health, pregnancy, and childbirth. They also focus on issues like menstrual irregularities, menopause, and contraception. When should you visit them? Women should have regular gynecological exams, which include pap smears. If you're planning for pregnancy, dealing with menstrual issues, or navigating menopause, your ObGyn is your key resource. Next, mental health specialists, psychiatrists, and psychologists. Mental health is just as important as physical health. Psychiatrists are medical doctors who can diagnose and treat mental health disorders with medications, while psychologists often provide counseling, helping patients manage anxiety, depression, and other mental health conditions. When to visit? If you're struggling with prolonged sadness, anxiety, mood swings, or other mental health symptoms that affect your daily life, seeking help from a mental health specialist is essential. They can provide therapies, medications, or a combination of both to support your mental well-being. So, there you have it. a brief overview of some of the key medical specialties and when it might be time to visit them. Remember, your health is personal, and having the right specialist in your corner can make all the difference in getting the best care possible. Thanks for joining me today. And as always, take care of yourself and stay healthy. I'm Dr. Sandeep Nagre, signing off. Please make sure to subscribe, leave a comment, or share it with someone who might benefit.